Okay, we just had this fantastic summary of the menstrual cycle, which I mean, for me is overwhelming and impressive. For you, it's probably a little overwhelming too, because you're probably like, wow, that was a lot of material in a very short period of time. To me, that's the amazing thing, because you have to understand, Dr. Steckton is like scratching the surface. This is all way more complicated, so it's really challenging to just get to the core of this stuff. And I think she just did an amazing job of kind of giving you a sense of how this happens. And to me, it's incredible because think about what's happening here. A human body is being developed inside of another human body. You think it's hard, like, to prep your dorm room for a party. Try prepping the human body for the growth of another human body. That is an incredibly complex process, and this is happening literally every month, over and over and over. And I think you got a pretty good sense of how that functions. But what I want to do now, what we always do in this class, is I want to understand some of the things that can go wrong, not just with the menstrual cycle, but with the women's reproductive system more generally, right? So I thought that, Dr. Steckton and I can kind of do this together, and I might just ask some questions I'm curious about in terms of how this stuff works, and it gives me the opportunity to learn along with you. And I guess, Dr. Steckton, the first question I would ask is kind of the most common question, which is, I don't know a woman, and I've probably never met a woman who hasn't had a bladder infection. It seems like they're incredibly common, and I'm sort of wondering, A, why are they incredibly common? And two, how serious are these?
Well, bladder infections are incredibly common. And they happen frequently because the urethra in a woman is so short compared to a male. That urethra has to go all the way through the penis. It's got a lot of barrier before a bacteria can go up. The female, it's really, really short. There's also, it's very close to the rectum, which is where most of the bacteria come from. And it also is increased with sexual activity because it's irritated or traumatized. So one of the frequent things we recommend is after intercourse, go to the bathroom and release the urine. That will help clean the urethra. They generally are really uncomfortable, but not super problematic unless the bacteria go all the way up into the kidney. Now that is getting to be a dangerous situation. But barring that, it's very, very, very uncomfortable, but you don't necessarily die of a urinary tract infection. We didn't have antibiotics for the first bajillion years that we were on this planet, and people weren't dying of urinary tract infections.
Right, so usually, I mean, I shouldn't say usually, it's possible that the woman's body will actually just fight the infection successfully, but it's good for her to see her doctor to speed up that process with some antibiotics.
That is correct.
Okay, and in most cases it doesn't get very serious, but don't ignore it because it could get serious.
It can get serious.
Okay,
yeah.
All right, interesting. I guess the other thing that I hear women frequently say is problematic is irregular menstruations or, more severe bleeding, severe cramping, things like that. How common is that? And if you could, sort of, what's the physiology of that? Like, you just described a system that sounds pretty regular and consistent. So why isn't it regular and consistent?
So that's two different questions. So one is the menstrual flow and one is the irregular periods. So in my world, that's two different things. When we talk about the menstrual flow, we talked about prostaglandin, and a lot of menstrual issues are from prostaglandin. So you have too much prostaglandin, it causes more contractions of the uterus, it sheds the lining more heavily, it causes a lot of pain, those contractions are causing pain. So one of the things we talked briefly about was using an antiprostaglandin like ibuprofen to help that. It is pretty common. A lot of women will have a day or two of menstrual cramps. It's when it is debilitating and you really can't function that you really should see somebody, because there are things that can be done. The second question was an irregular cycle. And cycle irregularities to me are interesting when a patient comes in. The first thing that I ask is, can I see a calendar of your periods? Because so many times people think that their periods are irregular and they're actually not. I hear a lot of, I got my period twice in July. Well, it happened to be the 2nd and the 30th, and now you've got a 28-day cycle, but it really just came twice in July. So putting your period on a calendar or an app really, I think, has helped people track the periods and figured out that often they are more regular than they thought they were. We also talked about how the follicular phase is highly variable, where the something just like stress and exams can delay the ovulation and cause an irregular period, and that's pretty normal. And you can sometimes go back and look at in a cycle where the cycle is longer than normal, you can go back and say, oh yeah, that was my exam time, that's why it was longer than normal. So it's interesting, yeah.
Okay. And then thinking more broadly about sort of the things that can go wrong with the system, one thing that comes to mind for me is fibroids. What are fibroids?
Okay. So fibroids are benign tumors. Remember, we talked about benign meaning not cancer. They are in the uterus, in the body of the uterus. They grow. We don't know why some women get them and some women don't. They can cause painful, heavy periods. They can also cause problems with pregnancy, or they can be completely benign with no ill effects whatsoever.
So this is basically just a mass of connective tissue that grows in an inconvenient place.
Yes.
Wow. Okay.
Yes.
And sometimes, and when we say big, I'm just kind of curious now, but when you say big, do you mean like a half pound, a pound, or like?
Well, some of the biggest ones I've seen have been like big.
Okay, so
like
yeah.
Bigger than baseball big. Yes.
Yeah, okay.
Yeah,
like
they can get
massive
pretty big.
baked potato
Yeah.
big.
Yeah.
Okay.
But surprisingly, I have also seen a woman whose uterus was about 3 times the normal size have a normal pregnancy with no issues.
Okay. So sometimes they're just masses that are there and your body doesn't seem to have a problem with it.
Yeah.
Okay. And that can happen, right? Okay. And then I know that another big problem that's probably more problematic, but you can maybe explain why, is cyst. And I know that my understanding is that cysts are always a little problematic and sometimes life-threateningly problematic. Is that right?
Not quite. So cysts form so we're generally talking about ovarian cysts. So they form in the ovary, and remember we were talking about recruiting follicles and how one gets bigger. There's several ways cysts happen. One is just from the recruitment of the follicle, that cyst doesn't actually ovulate and just continues to grow. So there's just extra fluid in there, and sometimes they get, like grapefruit size. Most of the time they don't. You can also get mucus in going into the cyst. So sometimes they're just fluid and sometimes they're mucus. Those tend to grow much bigger for whatever reason.
Yeah.
And then there's a really cool kind of cyst where they're from the cells themselves that would make eggs. They're called oh my gosh, I'm blanking.
It's all right.
Dermoid. Gosh, dermoid cysts, and those actually have.
I'm not going to cut that, by the way, because this is not the first time you see me stutter. It ain't just me.
So because they're from the germ cells, the cells that make everything, they are really cool because if you take them out, you'll see hair and teeth and yeah,
Just
it's
bits and pieces.
bits and pieces.
Okay.
Like,
Cool
can
is
almost-
relative here,
cool
but
is
yeah.
relative. So you can find a fully formed tooth in one of these cysts because it came from the genetic material that
Right.
makes everything in the body. So
Right.
it's super cool.
But not a fetus, just bits and pieces.
Bits and pieces.
Yeah.
No, it cannot produce
Right.
an actual fetus. You need a sperm and an egg, and
Right,
the two to conceive. With that would not happen.
right.
And most of the time, cysts are actually not problematic because they came from the ovulation. The body just takes away the extra fluid, and they go away. So those are called functional cysts. We see them all the time. Sometimes, as it's growing, that cyst is growing, it will bleed into the cyst because it ruptured a vessel. That's called a hemorrhagic cyst. Body takes those away too, so it's not necessarily a problem, but it can be a problem. Those mucus cysts, they can get really big. Those dermoids, they also can get really big, or they can twist. Any cyst that is large can twist that ovary, and now you have a problem with blood flow, and that's a medical emergency where you'd need to go to the hospital. Usually that would be found with pain. Severe pain.
Okay. And that's because you're blocking the blood's normal pathway, so then you get a buildup of fluid, and you get, I presume, inflammation and everything else you'd expect.
Yep.
And at some point that ruptures, and then you've got blood in your pelvis, I would think.
Possibly. More,
Okay.
it's the lack of blood flow
Okay.
because you've cut off the arteries.
Okay.
So it just like if you cut off the artery to your hand, you're going to get some gangrene. You start to do the same
I see.
thing with your ovary.
I see. This reminds me a little of an ectopic pregnancy.
Oh, sure.
Yeah, and I mean, I don't want to get too much into pregnancy because then we would need
Oh my
another
God.
12 videos just to talk about that, and this class is just a basic survey. But maybe you could tell us in basic terms, and I think this is a little bit of a public service announcement, as well. Like everybody should be aware of ectopic pregnancies because they can be a real threat, and at times women have symptoms of ectopic pregnancies and don't go seek medical advice right away, and that could indeed be life-threatening. So, with that as a preliminary, what is an ectopic pregnancy?
So what is an ectopic pregnancy? So you remember we had the ovum or egg coming out. You had the fimbria pulling the egg into the fallopian tube, and we said conception happens in the fallopian tube. Well, what happens if that now fertilized ovum implants in the fallopian tube? Well, it's a nice, moist, vascular area. It starts to grow and makes a placenta, and it starts to try and make a fetus. But the tube is not a nice, thick structure like the uterus that can expand and grow and hold that fetus. It is thin-walled, and the placenta drives all the way through, and the tube can't hold it, and it ruptures. So now you've got blood in the abdomen. It's a medical emergency. Usually there would be pain on one side. The person may know they're pregnant or not know they're pregnant. It's always important to think about. The weird thing though is because it's not a great pregnancy, the menstruation or some spotting may already have happened. So people get really confused. They're like, oh, well, I had bleeding. So I had my period. But it turns out that was almost a false period and throws you off. So it's really important if there's any possibility of pregnancy and there's pain, especially with bleeding, you got to get in and get checked.
Wow. So basically this is sort of a sexually active woman who might just be, yeah, my period was a little wonky and I've got a little bit of a pain here, like when I bump up and down, I can kind of feel it and it hurts in my pelvis somewhere. No big deal, maybe it'll go away. And it turns out this is life-threatening.
Yes.
Wow. Okay.
Yep.
And then what, you go to the ER with this, and if this is the case, what, it's surgery, you have to remove that?
Well, it is never going to be a pregnancy that ever has a baby.
Right, it's not
Like,
viable.
it's just not viable.
Okay.
It's not gonna. I didn't know that you had said the word viable. It's
Oh,
not
sorry.
Viable.
We will. Yes. I feel like viable is not a medical term. Viable is just like that's not viable.
That's true.
But
Okay,
fine.
You're right. You're right. So it is not viable, and it can either be treated medically or surgically, and it depends on how far along, how big it is, etc.
Okay.
But it needs to be treated. It is not something you can just leave.
Okay. I guess along the same lines, because we're talking about scary shit, I'm thinking about infections. And of course you can get, a vaginal infection. There's kinds of infections you can get. And I know that one of the more problematic infections or types of infections in your line of work is pelvic inflammatory disease, PID.
Yes.
And maybe you could just kind of give us a sense of what kinds of infections are possible. And then when it rises to the level of PID, what are we talking about there?
Okay.
So talk about infections.
Oh my goodness. Yes, I told you we should have rehearsed this. So PID, pelvic inflammatory disease, is where bacteria get up through the reproductive tract, through the uterus, out the fallopian tubes.
This doesn't sound good.
It's not good. And infect the tubes, the ovaries. They can make abscesses, which are collections of pus in the pelvis. It can rupture organs because it's everything is just growing with abscess. Yes, it is really bad. It is something that needs to be treated. And the earlier you treat it, the sooner you treat it, the better it is.
So this is bacteria growing all over the place, and then of course you get the inflammatory response. So now you got extra fluid, you got mucus, you got everything we talked about before, phagocytes and all that doing their business there, and everything's getting big and swollen, and things start falling apart.
Yes, and it can even lead to scar tissue and infertility.
Of course, right, because that scar tissue is the inevitable result of that inflammatory process. We'll remember that. Yeah. Interesting. Wow. So, I mean, does this always begin with, say, a vaginal infection that then just gets worse?
We have always said it's from a sexually transmitted disease, but it does not seem to always go like that. A lot of people don't know. We almost never know which bacteria it is. It tends to be multiple bacteria. Generally, we're not going into the abdomen like with a camera or laparoscope or something, right, and checking like what is the bacteria. I have almost never known what bacteria it is. You do cultures for gonorrhea, chlamydia. Most of the time, it comes up negative.
Right. So you just take what we call a broad spectrum antibacterial that is going to fight whatever it is. And I presume at this point the person's in the hospital with an IV of the antibiotic.
If it's bad enough. So early PID is treated outpatient.
Oh, really?
With pills. Yeah.
Wow.
Mm-hmm.
Okay. Okay, so I'm not an expert. What did I miss? What other weird and wonky things happen in the female reproductive system that are interesting?
Geez Louise.
It's possible that I got it all because I'm just that smart, but I doubt it.
Trying to think of things that I see commonly in the office or in the hospital. I think you've hit most of the main.
Can I ask about one more that I just thought of?
Sure.
And I know it's a complicated one, but endometriosis.
Endometriosis.
Which I understand is what could be called like retrograde menstruation. Your menstruation's not flowing forward and out of the body as it should. It gets backed up. Is that about right?
We used to think so. But now we don't know.
This is what happens. You see, people teach us stuff, and then other people learn more, and then you don't know the stuff you thought you knew.
So, endometriosis is it's tissue that's very much like the lining of the uterus, the endometrium that we've been talking about here in our menstrual cycle, in a place where it doesn't belong. So it can be on the ovaries, it can be on the fallopian tubes, it can be in the pelvis. there can be just a little. And imagine when you have menstrual flow, there's blood. Well, in that same weird tissue, why is it somewhere where it's not supposed to be? Well, now it's got menstrual flow somewhere that it's not supposed to be, and that menstrual flow generally can't get out because it's not flowing out of the uterus. So it causes pain. Right. It can cause what we call endometriomas, which are basically where the endometriosis has bled into a sac and now is like old blood in a sac. Right. It can cause infertility. But the weird thing about endometriosis is you can have a pelvis full of endometriosis and no symptoms, not even know. Or you can have just small implants of endometriosis and be doubled over every month with your period. We just don't know. So
depending, I imagine, on sort of like where the sacs are, where the blood pools, how much pressure there is wherever it's trapped.
Yeah, honestly, we don't even know.
Right, right.
Generally, the first symptom is pain, and we usually treat pain with turning down the cycle. Just stop the cycle. So if the endometriosis can't bleed, it goes down. It's just like somebody who has a really heavy flow or a lot of pain, just turn off the cycle. We do that with birth control pills. Just overwhelm the estrogen and progesterone with a estrogen and progesterone from a pill. Everything goes dormant, right. And it tends to really help with pain syndromes. You also can treat it surgically, but that is not first line, because the surgical management in and of itself, if it's not bad enough, you can wind up with more problems than you were fixing.
Right, because you're creating adhesions, scar tissue,
etc. So the first line of treatment is always just try and just settle everything down by turning off the cycle.
Right, right. I'll tell you what, I mean, I don't know about you, but first off, I found this really interesting. But the second thing for me is how much all of this makes sense, because basically it turns out that these organs are no different than other organs, right? It's about inflammation, it's about compartments, it's about pressure, it's about flow, it's about the inflammatory process, it's about scar tissue. Remember, we talked about adhesions before. That just basically means slight scar tissue that's holding things together that shouldn't be held together. So really, it's really, thanks very much, because this to me kind of allows us to understand this system in the same context of other human body systems and see kind of all the similarities. Did I miss anything?
Oh,
yeah, right. Why do
you keep asking that?
Open the can of worms. No, this is where I have to end it, because at this point she's going to go on for like another 4 hours. I'm going to find it tremendously interesting, and you're going to ask the obvious question: is this on the exam? Right. So we're gonna stop it with that. But thanks very much for your time, and thanks for your excellent presentations for this course.
Thank you.